It may be arguable to say that many more women today are opting for the cesarean section of childbirth, though this form of bringing a baby into the world is supposed to be purely for medical reasons for the safety of both the mother and child. Some women are choosing this to avoid the pain associated with natural birth. We find out from health experts whether the C-section is the best option even when a patient can deliver her baby naturally.
The decision on how to bring a baby into the world often rests solely with the mother and the doctor, who guides and offers advice as the experts. The most common is the natural birth or the vaginal birth, where a woman, with the help of birth attendants or midwife, delivers her baby through the birth canal. But over time, there are countless options one can choose from. It could either be the natural birth, water birth, or cesarean section. Cesarean section, which is commonly known as C-section, is one of the assisted deliveries, but involves major surgery when a vaginal delivery would put the baby or the mother's life or health at risk. It could be elective or due to an emergency based on the condition of the mother and child. Some women choose this option even when they are fit. They give reason to be that they just can't bear the pain of natural birth. Others also say they want to keep their figure intact, but the World Health Organization (WHO) recommends that C-section should be done purely on medical grounds. So we ask Dr. Edward Mahama, a gynecologist, under what other conditions apart from medical will a doctor or a patient have a C-section performed?
There is part of the pregnancy we call the afterbirth, the placenta. It is supposed to come after the baby has been born, but sometimes it may be coming earlier, or it may not be coming, but it may start separating. It is attached to the baby and gets nourishment from the mother to give to the baby. If it starts peeling away from the mother, it means the baby's means of nutrition is cut off, so the baby will die. In that case, we may have to intervene. The mouth of the womb or the cervix, there is tissue there like a rubber band. It stretches when you are in labor, but when you are not, it goes back this way to hold the baby up there for the baby to get to 9 months. So if you go and do an abortion by a doctor who is not qualified, who doesn't know what he's doing, by a quack, and they damage this, it loses that elasticity. So when you go into labor, you are unable to stretch the cervix, so you may have to have a cesarean section.
We also find out if previous C-sections will automatically mean the mother would have another child by C-section.
If you have had one cesarean section, you can deliver normally. But the issue is, why are you having that first one? If the reason for which you are having that first one is a recurrent reason, for example, you are having it because your pelvis is small and the babies you are carrying cannot come, that's a recurrent reason. But reasons such as you are pregnant and you start bleeding because your afterbirth is lying ahead of the baby, once that is the reason, next time if the afterbirth is not ahead of the baby, you can deliver by yourself.
Dr. Edward Mahama said C-sections are safe but also have their own risk.
It is still an operation, shouldn't be taken lightly, and should be taken only after an informed consent. Informed consent means that we've told you, for example, you can bleed during cesarean section. Even the anesthesia, you can have complications from the anesthesia during the cesarean section.
Most cesarean births result in healthy babies and mothers, but such major surgeries also have their own risk. The healing process takes longer than with vaginal birth. Also, patients may stay longer in the hospital to be properly supervised. Plus, it is an expensive procedure.